name is Abby. I'm the nurse here, one of the nurses here on the unit, and I'm going to be going over your discharge medications with you.
Okay.
Okay? Can I see your list, please? All right, and can I have your name and date of birth?
Mr. Valentine, 11XX.
Okay. All right, Mr. Valentine, as you are aware, you're here because of a recent heart attack. So I just want to go over some of the signs and symptoms so you can recognize in the future if you do experience another heart attack, you'll be able to catch on early. So some of the signs and symptoms are chest discomfort, so you'll feel like an abnormal amount of pressure on your chest, pain in your jaw, cold sweat, nausea, discomfort in one or both of your arms. Is that something that you experienced before coming into the hospital?
Yeah.
Okay, so that's something that you should be aware of, looking long term and knowing like some of the causing factors for that. It could be diet, it could be lack of exercise, and things like that. It's just something you want to be aware about. So the doctor prescribed for you a new medication. It's called metoprolol. Another name for it is Lopressor, and what that does is it's going to decrease your blood pressure and your heart rate. So in your case, it's used to help with your high blood pressure for prevention of heart attack. So some of the side effects that you want to look out for are fatigue, weakness, dizziness, drowsiness, low blood pressure, and erectile dysfunction. So, Mr. Valentine, can you tell me why you are taking this medication and name me 3 side effects?
I'm taking it because it's going to lower my blood pressure and then prevent future heart attacks. And side effects are dizziness and low blood pressure and weakness.
Okay, great. So some of the other things that you want to look out for when taking Lopressor, that it may alter the effectiveness of insulins, which you were just recently put on Lantus and Glargine. So that's something that the doctor's going to have to look at and may make some medication adjustments for your Lopressor. Another thing that Lopressor can do is if you're taking any other high blood pressure medications, it could increase your low blood pressure. So that's something you just want to be careful about and watch out for. So when you're taking Lopressor, you want to monitor your heart rate, and you can do this at home. You can do that by checking something called your radial pulse. So your radial pulse is located here on your thumb side, and it's right in this little crevice right here, and you can feel a little pulsation. You feel it?
Yes.
Okay. And so when you're taking your radial pulse, you want to hold it there, and you want to watch. If you wear a watch, you want to watch for 30 seconds and count how many pulses are within that 30 seconds, and you're going to times that by 2, and that's going to tell you what your heart rate is. So that's something that you can do at home, and you can check for your heart rate, make sure it's not too low, make sure it's in the right range, which is about 60 to 100. Okay?
Mm-hmm.
So then when taking Lopressor, you also want to be careful with changing positions. So if you're lying down and you want to sit up, you want to go slowly, and you want to be careful because of that low blood pressure, which can cause you to possibly fall. So you want to be careful about that. So now the doctor has put you on insulin, and one of the diabetic techs came and talked to you about insulin and different kinds of insulins. So I'm just going to show you how to properly inject insulin. So what you want to do is you want to gather your supplies. So you want to have a Sharps container If you don't have one of these, you can use a laundry detergent bottle, something that's not see-through, and something that has a tight cap on it. And you want to just write "do not recycle" on it, so you don't recycle those used needles or lancets. So I'm just going to take my my pretend skin here. I'm going to grab my insulin. So you want to make sure you have an alcohol swab, which you can get at your local drugstore, CVS, Walgreens, Rite Aid. So those are available for you. And then you have your syringe with you. And then I also like to recommend a gauze pad. And you can also get those at your local drugstore as well. So what you want to do first is you want to wash your hands. And you want to wash your hands with, I'm going to use hand sanitizer here, but you want to wash your hands with soap and warm water. And when you're looking for your injection sites, you have two possible sites. You could do it in your abdomen, which is the most popular, or you could do it on the sides of your thighs. And you want to make sure it's the fatty part so that it doesn't hurt as much, and there's no bruising, and there's more absorption in the fatty parts. So I'm going to put my gloves on. And what you want to do first is you want to make sure you have the right insulin, first of all. You want to make sure you have the right insulin, and you want to make sure that the expiration date is correct as well. So the expiration date, insulin's good for 28 days. So you want to make sure it's within that 28-day range. So after you make sure that you have the right insulin, you want to mix it, but you don't want to shake it. So you just want to rub it back and forth gently, just like this. And that's going to help mix it all together. So I'm going to mix it. Now that it's all mixed, I'm going to open my alcohol swab. And I'm going to clean the top of the insulin bottle, so it's nice and sterile. I'm going to clean that. I'm going to let that air dry. So while I'm letting that air dry, you're going to take your needle. I'm going to take the top off. And you're not going to put any insulin in it yet. What you're going to do, because you're taking 10 units once a day at noon, you're going to draw the needle with air at 10 units. So I'm going to put that at 10. So now my needle is at 10 units. So now what I'm going to do is I'm going to inject my air into my insulin bottle. Going to inject it. But I'm not going to pull the needle out. You see, I'm going to flip it. And you want to be careful with the needle because the needles are delicate. So you don't want to be careful it doesn't break. And then I'm going to draw it up to 10. It's okay if you go past 10 because you want to get rid of those air bubbles. So I'm going to go to 20, and then you can push it back up to 10. Right? So once I'm at 10, I'm going to pull it out. And you can flick it if you see some air bubbles. That's how it gets rid of air bubbles there. I'm going to take my alcohol swab, and I'm going to rotate in a circular formation about 2 inches at my injection site. And when you're injecting, you want to make sure that you rotate sites. You don't want to inject the same site all the time. So I'm going to pinch my skin, and I'm going to inject at a 90-degree angle. So I'm going to insert, release the skin, and I'm going to inject my insulin. And because it's a needle, you're going to leave it in for about 5 seconds. And then you're going to pull straight. And you're going to use the gauze pad to keep that insulin in the skin. And so you're going to discard of your needle. And now that that's all finished. And those are the steps. Now can you tell me back what the steps are to injecting insulin?
I have to wash my hands first with warm soapy water, and then I have to check my insulin bottle to make sure it's the right insulin and it's not expired. and then I have to wipe the top with an alcohol swab, and then take the cap off the needle and pull the plunger back to 10 units,
Mhm.
and then inject that into the bottle and push the plunger down, push the air into the bottle, and then turn it upside down, pull the plunger down to 10 units, and then clean the skin with the alcohol pad in a circular motion, pinch the skin and stick it straight in at 90 degrees, and then push the plunger and leave it in for 5 seconds, and then take it out and hold a gauze on it, and then discard my needle in the sharps.
Okay, great. That's perfect. So I have some handouts here for you. It's basically the same thing that we went over. It goes over the steps for drawing out insulin and injecting, and it gives you some of the injection sites. And then this one's just basically some reading material, just basically going over the same thing that we did. Goes over properly pinching the skin, and then it goes over some of the injection sites, and then some of the rotation methods you can use. So you can either go straight across your abdomen, just like this, or you can do it like in an S, and you can rotate for that. So since you left your glasses at home, the unit has provided a page magnifier for you.
Oh, nice.
So you can read over the material.
Okay.
Are there any questions that you have for me?
No.
Okay, great. Thank you very
Okay,
much then.
thanks.